Hey everybody, welcome. This is the 2019 edition of the Pierpont EMS Preceptor Training. So thank you for choosing to participate as being a preceptor for our EMS students. Your service provides a major component for the success of our students. By participating in this, you're simply paying it forward for all those who helped you get to the point where you're at. The purpose of this presentation is simply to instruct you as the EMS preceptor of our expectations of you and our students and just kind of how all this is going to unfold. It's going to ensure just consistency and accountability of all of our preceptors, and also for the paramedic side of it, this is an accreditation requirement. The student's role in all this is they need to arrive promptly. As we tell the students, every day out in the clinical setting is a job interview. So they need to really treat this like they're coming to work. They should arrive promptly and they should be well dressed and well groomed. So our requirements for appropriate attire include a Pierpont polo, that's for the paramedics only, appropriate pants and foot attire. So generally for going out onto the ambulance, it's that navy blue tactical style pants to dress in the kind of pants and boots that everybody else on the ambulance is wearing, and having the proper Pierpont identification tag. Those are all accreditation requirements that they are able to easily be identified as a student. So if they're in the clinical setting, that pants and footwear may change a little bit. And again, depending on which clinical setting they're at, if that clinical setting requires that they wear scrubs, then that's fine. They don't have to have that Pierpont polo on outside of those scrubs. They must at least meet our dress attire if the clinical dress attire is not a different requirement. They gotta have good personal hygiene. They need to be well kept, well groomed. They can't show up and be stinking, have it on dirty clothes. They only get one polo, so hopefully they're washing this in between the clinical settings. The student's going to be there to do assessments and skills under the direct supervision of a preceptor. That's why they are there, is to gain skills and knowledge, both mental knowledge, skills applications, everything. They also need to be an advocate of that patient. They need to show that they care, learn those good bedside manners as well. They also need to abide by all the agency and departmental policies. They got to represent Pierpont to the highest degree. We understand that you as a preceptor are gaining nothing out of this except paying it forward. We don't pay our preceptors, none of the clinical settings. Nobody gets anything out of this except simply paying it forward and helping our students. So our students are instructed that they need to respect that. Any deviation from these standards must be reported on the students' evaluation forms. If they, just aren't being a very good student, or they're weak in their skills, weak in their knowledge, we need to know this stuff. The preceptors are acting as our eyes out in the field. So now preceptor responsibilities. Be a role model and lead by example. We need to instill a good sound foundation for the student. So no tricks and shortcuts. We need to teach them by the book to make sure that they're comfortable with everything they need to know before they can start developing shortcuts. You're going to supervise and educate those students. They're looking at you like you're the subject matter expert, so be humble in that too. Don't make up something. If you don't know something, be honest and tell the student you don't know, but help them look it up. Oversee all their skills, everything they're doing. Use this as a complete educational opportunity and give them positive, constructive feedback when you're supervising and educating them. If they did really good on skills, tell them that. If they need some help, don't be afraid to tell them, hey, you're lacking at starting IVs. Let's go in here and practice, or anything. You need to evaluate and help them along the way. Also, be sure that those students are abiding by policies and procedures of your agency, department, and those that we claim as well. Maintain a high level of moral and integrity when filling out those evaluations. Those evaluations are extremely important to us. Don't just put fives across the board. That doesn't benefit the student at all. The first round of clinicals, no student should ever be getting those high remarks on any evaluation. Even almost at the end of their program, they should not be excelling at anything. They're entry level providers, so they need that appropriate kind of feedback. If they are not abiding by those policies and procedures, you have the ability to send them home. If they show up stinking with poor hygiene, or they're just not being a good team player, they're just not in the right mood to be there, they show up, they look hungover, send them home. As a preceptor, a strong fundamental you need to remember is once this student becomes a card-carrying paramedic, they are a reflection of you. So work with that student while you have the chance to make them a great paramedic. So then once they're done, you're not complaining about how poor of a paramedic they are and use somebody else as a scapegoat. Take the time, build up these students, make them great paramedics so you can take pride in claiming this student as one of your own. In the field, that crew must be a minimum of 3 people. That includes you, the preceptor, the student, and your partner, whoever's going to be responsible for driving the ambulance during the call. So you and the student must be in the back of the ambulance with that patient. As a paramedic preceptor, you must be working for at least 2 years at your certification level of a paramedic, or have done at least 750 ALS calls and ultimately just approved by the clinical coordinator. To be an EMT preceptor, 1 year of experience at an EMT minimum. Also, as a preceptor, you must be in good standing with the West Virginia Office of EMS and within your respective agency. Your agency must also be giving approval. They also have the right to revoke your privilege of being a preceptor. Your role as the preceptor is to be an extension of our program. You are basically a teacher in the field. So you're going to oversee everything about that student, and so overseeing their assessments, all their skills, interventions, every single thing that they do. You need to be helping them establish fundamentals of being being a paramedic or an EMT. Because remember, they're still at the learning and developmental stage, so they're not going to be as smart as you are. But they expect you, as a seasoned EMS provider, to be the subject matter expert. So teach them by the book. We're not looking for shortcuts. Teach them the fundamentals. And as a preceptor, you're only going to allow them to do a skill that they've been checked off on, or administer medication they've been checked off on, and that's for the paramedics. And those will be based on those skills, evaluations, and authorization forms, and that med administration authorization form. Take the time at the beginning of the shift to review with that student where they're at in class, kind of what their baseline knowledge level is of EMT or paramedic, wherever they're at, or both. Skills that they're going to be able to perform, meds they can give, any areas that they might want help in, something they're covering in class that they're not real sure on, and just overall discuss with them how they're going to fit into your team throughout that day, what your expectations are, and what they'll need to do. And also just familiarize them with everything going on, the facility that they're at, location, supplies, equipment. They should be in there with you helping check off your apparatus beginning the shift, and overall just give them a good welcome feeling. We all remember that feeling, that being a nervous wreck during some of these clinical shifts. This medication authorization form is new for 2019. This is the updated list of medications that we cover within the program. So only medications that have an authorization signature or initial beside them are the only medications the student is allowed to give. And with that, if they are authorized to give it, they should be able to tell you the doses, indications, contraindications, a lot of information about these medications. So use that time to put the student on the spot and quiz them to help them learn more about pharmacology. The skills authorization form is essentially just about the same as the med authorization. Whatever's been signed off on this by an instructor is a skill that the student is allowed to perform. If it's not been signed off, they can't perform the skill. During the shift, use every patient as a learning experience, no matter if it's a really crazy call where they got to do a lot of things, or if it was a simple call that was basically BLS, but you ALS it for the student. Every call is a learning opportunity. There's always something to learn from every single call. And just remember, you're the expert in that student's eyes, so they're going to be looking up to you. So if you've already got bad habits, guess what? That preceptor is going to pick up your bad habits. So be an advocate of the profession. Be out there, be the best paramedic you can, or the best, clinician that you can to set that good example for the paramedic. And let them gain experience. Let them get in there and do things. They're not there to just shadow and oversee things. They're there to learn in a hands-on environment. So let them get in there, let them get dirty, let them do skills, give medicines, do the assessments. Don't let them shortcut the stuff. Let them get in there and do it. And use that downtime proficiently. So if you've got a slow day, make sure that when you are down, you're not just napping. If they're using that time to study materials, review stuff, quiz them, see what they know. That time, it's so critical as a student. It's a very tough program, and time is always a major issue. So if you've ever been into our facility, you always will see the signs talking about the time management is a critical skill. Do not let them waste any time. These completion requirements are also new for 2019. You'll see the breakdown of everything that the student needs by assessments by age ranges, assessments by their impression, assessments by the patient's complaint, and a minimum number of skills and interventions that they need to perform. Also, in the bottom there's some language that has changed up by accreditation is the terms of field evaluations and team lead. So during spring and summer, those are field evaluations where you're helping them through the calls. They're still kind of fundamentally getting a concept of everything. But in the fall is what we call the capstone term, and that's when they need to actually be a team leader. So they should be able to go out there and just orchestrate everything. So you see they have to have a total of 20 patients in the pediatric category, and they're going to get a lot of these in the hospitals too. But you see quite a significant number of patients, 50 adult patients, 30 geriatrics, 20 pediatric patients overall. So they have to have encounters with 100 patients in the field and clinical settings. And in the category of medical, you'll see there in the assessments by classification or impression, that pretty much covers any patient that doesn't fall into the categories of obstetrics, trauma, or psych. So the chest pain patients, the difficulty in breathing patients, the my toe hurts patients, the stroke patients, anything else outside of those categories falls into that. The field evaluations and team leads are broke down by semester, and those have to be ALS calls. So an ALS call constitutes an emergency response, and the student has performed the interview and physical exam, as well as obtaining vascular access and putting them on the monitor, or giving them a medication and putting them on the monitor, or vascular access and medication administration. It doesn't even necessarily mean that they have to be transported, such as those diabetic emergencies to where they're in the house, they start an IV, they give them D50, and the patient signs off. As long as they assess the patient, did the skills, gave the meds, that's an ALS call. Or if they, give IM medications and put them on the monitor, give them meds, put them on the monitor, even simple as that IV O2 and monitor, basic things like that. Now, oxygen and oral dissolving Sofran do not constitute as an ALS medication, so they can't give them oxygen and just put them on the monitor and count that as ALS. They would have to perform an IV with that too, same as oral dissolving Zofran, and the monitor. That's not ALS, that is BLS. For the EMTs, it's a lot more basic. So the EMT just needs 10 patient assessments throughout their time on the ambulance. So that doesn't necessarily mean, again, that the patient has to be transported as long as they've assessed that patient. So they've gotten there, asked questions, took some vital signs, became part of the call, and acted as an EMT. That's going to count as an assessment. They can intervene within anything within the BLS protocols. So if you have an EMT student and you're a paramedic, if you want to give them a nebulizer treatment, the student can do that as long as that falls within the BLS protocols. But don't be letting the EMTs try to start IVs and do crazy skills that they are not signed off or they wouldn't do as an EMT. Now the forms that they're going to fill out are, in the field setting, is the patient contact form. This one here is for the paramedic only. This is the same information that they will use to log all their information into FISDAP, which is essentially our charting system, how we track all their patients, all their skills, all their interventions. So this form here is only used on the ambulance. They are required to have one of these per patient. Essentially, this is their PCR for that patient that they had as a paramedic student. And this is the form that the EMT uses. So again, one PCR per patient. So they fill this out exactly like a run sheet, so all the HIPAA information is not on either of these sheets. But this is what they use to go ahead and be practicing filling out narratives, practice filling out run sheets. When it comes to evaluation of that student, that's why they have the evaluation forms. So you'll need to complete the shift evaluation of the student, how they did overall throughout the day, and that field evaluation or the team lead evaluation form, depending on which part of the program that they're in. All those evaluation forms must be signed. Please leave good comments and be honest on those forms so we can get the feedback. If there's major issues with students or you feel like they're really screwing up, and please just contact us directly. Anytime there's ever an issue with a student, please give them the feedback. Let us know on those feedback forms, because we look at all those evaluation sheets, and just ultimately contact us and let us know. The field evaluation form, this is the one that they're going to be using during the spring and summer terms when they're still getting things kind of pieced together. They're still working through the motions. So you're going to rate them on that Likert score of 1, not acceptable, 5, did excellent. We truly don't expect students to be at a 5 in the initial stages of their paramedic training. So be honest in those responses to help evaluate these students appropriately. And in that comment section, please be honest and leave us some feedback. The shift evaluation is the overall picture of how they did throughout the entire shift. This is one that's done for EMT and paramedic. So this does not have to be done per call, just overall. One shift evaluation per shift. As I covered before, there is a portion of the paramedic program that's called the Capstone term. And this information just pertains to that Capstone term. The purpose of this presentation is to instruct you, the EMS preceptors, in the changes and the flow of how everything goes during the Capstone term of the paramedic program. This is an accreditation requirement just to make sure we're ensuring consistency and accountability with all of our field preceptors. So what is a capstone, you might ask? Our accreditation defines it as the activities occurring toward the end of the educational process to allow students to develop and practice high-level decision-making by integrating and applying their paramedic learning. So basically, at this point, the students should pretty much know everything. They should be able to function as a paramedic and truly be a team leader. So they should be able to go out here and run the calls. So basically, this is their true internship, that they should know the knowledge. They are here applying everything they do, but they're still being shadowed. So the student's role ultimately is to be the leader of the team. They should be able to orchestrate and lead the overall care of the patient. At this point, they're leading the team, so they're not to be evaluated necessarily on doing the ALS skills. They should be out there applying their knowledge. So to be getting their team leads, they don't have to be responsible for single-handedly doing the IVs, doing that med. They should just be able to function and lead that team. So it's kind of a tough part where you as a preceptor, you need to kind of set back and let this paramedic student be making the decisions, be running the call. So your role as a preceptor is just being part of that team, letting that student take charge, be a good partner, aid in providing patient care, and ensure that that student is making the right decision. Don't blindly let the student tell you to do something wrong. They should be doing the right thing. If they're not, then you take over, you take charge, and you're now responsible for the patient again. Ultimately, you're evaluating the competency of this student before they're being released into the wild as a full paramedic. As a review, here are all of the requirements a student must meet by the end of the program. So the big things you see highlighted in red is there's 25 team leads. Those have to occur during this capstone term, the final semester of the paramedic program. Otherwise, there's all the assessments, the complaints, the impressions, and the skills. All the students have been evaluated prior to entering the field internship, so they know where they stand, they know what kind of assessments they need, what skills they themselves need to complete. So they should be able to know and tell you exactly where they're at on IVs, meds, ventilation, intubations, assessments, everything that they need. For the team lead call, it still needs to be an ALS call. So this still has to have ALS skills done, whether that's a successful IV and being put on the monitor, or a medication administration and put on the monitor, or IV and med administration. Combination of those, ALS care must still be performed, and still oxygen and oral dissolving Zofran are not ALS medications. The only difference being now is those skills and interventions don't necessarily have to be performed by the student. They can be given by the student or the preceptor or a combination thereof. But still, those ALS care must be administered to that patient to count for an ALS team lead. And there must be 25 of those ALS team leads during this final term. The team leader evaluation form is different than the forms we've used in the past. So where in the past it used to be the Likert scale of the 1 through 5, good to bad of how well they did. Now it's either they were successful in that dimension of team leadership or they were not. To be considered a true and to count as an ALS team lead, they must be successful in every dimension of team leadership, from scene size up and management, the initial assessment and exam, the treatment plan, the communication, the skills, and the overall leadership. They must be marked a yes on each one of these to count as a team lead. We do expect you to be honest on these. If they're still struggling on this, we can't count it, because when we get feedback about, well, this student's out in the field, I don't know how they ever passed, well, this is what makes them count. If they're not out here being a team leader, being effective as a student, we can't be counting those as team leads. They're gonna have to get the skills to be competent to enter the field. So that's up to you to leave good comments and feedback and to be honest in these evaluations. If they're just botching it, you can't be counting those as successful in those dimensions, so that we're not counting them as team leads if they're not being a team leader. At the completion of the shift, the students need to report to the preceptor before leaving. The student is not just supposed to be, okay, it's clock out time, I'm out of here. They need to get with the preceptor before they leave. It's the responsibility of you as a preceptor to ensure that student fulfills their entire shift. If they're supposed to be there 2 to 10, they should be there 2 to 10 unless other arrangements have been made or they tell you that the instructor has been notified. Again, if you ever have questions on this stuff, you can always contact us, but on those forms, you should see the time where you sign them in and sign them out. Make sure those times are the correct times. That You as a preceptor are responsible for filling out all the evaluation forms. And again, honest evaluation. Be truthful. If they were lacking in some areas, or they just weren't that good in things, or they had some poor hygiene issues, anything related to that, you need to put that on those evaluation forms. That feedback needs to be given to each student. So at the end of that shift, give them a quick rundown of how they did, whether they did really good, they did kind of poorly in areas. Any kind of correctional feedback, we just ask you do that in private. If they really struggled or they did something really wrong, don't publicly bash them. Put them in privacy. Go over the things they need to work on. Don't humiliate them in front of your peers. Positive reinforcement, just depending on the personality of the student, you can do that in private or in front of others. Some students might just want all their feedback done in private, or if it's good stuff, they may like being able to receive that positive reinforcement in front of all your peers. With those forms, give them to the students. They're required to scan and upload all those forms into FISDAP, their charting and documentation system. They might ask to utilize your scanner at your department if they don't have one at home, since they're required to upload these forms into their documentation system. If you have any questions during the clinical setting while the students are there, please take these numbers, write them down, and save them. The students all have this contact information as well too if you need it. If you have any issues with students, immediately contact us. Send us an email, call one of us, contact us some way to let us know immediately if there's issues with students. If it gets to the point where you have to send a student home, please feel free to do that and then contact us afterwards. We just ask you keep us in a loop about anything. So if you have any questions, concerns, please always feel free to contact myself, Ben Tacey, as the program coordinator, or contact Rusty Taylor. He is the clinical coordinator. And also, if you're going to email us, we just ask, go ahead and put both of us on the email to keep us both in the loop. Again, we just thank you for participating as a preceptor for our students. If you ever have any questions or need anything, please don't hesitate to contact us and ask.